Upon opening your prescription from us, check that the tube is properly sealed at the crimped end. Although this is checked before leaving the pharmacy, sometimes pressure in transit on an incomplete seal can cause it to leak. Check that you have a vaginal applicator included in your bag. If the medication is meant to be applied to the vestibular, vulvar, or labial region, you may not have an applicator included. The applicator should be contained in a plastic wrapper that should be removed and discarded before the first use. Notice that the applicator has two parts, the barrel and the plunger. The plunger is labeled in 0.5, 1, 2, 3, and 4 gram increments. This is important to know for how much cream you will be applying. The plunger should move freely within the barrel. Notice the grooves at the end of the barrel. This is where the applicator will screw onto the top of the tube of cream. The applicator can be taken apart and should be thoroughly cleaned after each use. To do this, simply pull the plunger from the barrel and wash with warm soapy water and lay out to dry. Reassemble before next use by placing the plunger inside of the barrel. The most important step to properly applying your medication is to take a look at the label on the tube. Notice the beyond use date of the medication to ensure that the medication is still good to use. If today's date is beyond that date, it is best that you get a refill of your prescription to ensure the highest quality product. Also, make sure you know the dose of your medication and how to use it. Depending on your condition or situation, directions can range for each patient. It is important to wash your hands before applying the medication so as to not spread bacteria to the vaginal area. The plastic tube is equipped with a cap that can be screwed off and set aside for the time being. Hold the tube upright so the cream has no chance of leaking out. With the tube in one hand and the applicator in the other, screw the end of the barrel onto the top of the tube. Make sure it is completely screwed in so none of the cream leaks out. Also, make sure the applicator plunger is fully inserted into the barrel before you screw on the tube. This will prevent air from entering into the tube. At this point, you can gently press on both sides of the tube and fill the applicator to the dose your doctor prescribed. In this case, let's say half a gram. The cream should be filling the end of the applicator that is attached to the tube. Once the plunger gets to the desired dose, unscrew the applicator from the tube. In this case, the cream was pushed to the 2 gram, but that's okay. You can just push the plunger back in till you get to your desired dose, and then unscrew the applicator. The reading on the plunger should reflect the amount of cream in the applicator. Remember to place the cap back on the tube in between uses to ensure the medication does not dry or leak out. At this point, you will continue with inserting the cream vaginally. See our video titled Vaginal Applications, Inserting a Medication Vaginally for more information on how to insert the cream.